Good morning. I am Stephen Blair and I'm a consultant specialist varicose vein surgeon working from the Liverpool Varicose Veins Clinic. Today I would like to talk to you about ClariVein ablation of major varicose veins. We've been through a learning process where we've gone from doing surgery to laser or radiofrequency, and now we've come to what I believe is the best treatment, which is ClariVein ablation. In simple terms, this involves putting a wire inside the vein under a little bit of local anaesthetic. You don't really feel this, but then a button is pressed and it then feels a bit like an electric toothbrush as the wire whizzes round inside the vein, destroying it from the inside. Afterwards, you can get up, walk out with the bandage on, drive home, or go back to work. So this genuinely is the simplest way to treat your veins. So the first thing that I need to do is to identify where the vein is using a scanner. It appears as a black line at the top of the scanner screen there, and then when I know where the vein is, I put a little bit of local anaesthetic into the skin. This numbs the skin, it stings for a couple of seconds, but then means that the rest of the procedure is completely pain-free. A tiny nick is made through which the needle goes, and that enables pain-free procedure to carry on. In order to get a needle into the vein, I do it looking at the screen on the ultrasound scanner, and therefore we can get a good access for the ClariVein catheter. With the needle in place, a guide wire is put up the wire to keep it in the right place. Here's the scanner. At the top right hand corner of that screen you can see a little white blob coming in. That's the end of the needle, and then it'll suddenly give way as it enters the vein. So we're home and dry, the guide wire is in place, the needle is removed so there's no sharp bits around, and a plastic catheter is put in to replace the needle. This gives direct access for the ClariVein catheter, which is going to go right up to the groin, because that is where there is a valve between the deep vein and the surface vein. Where that valve has broken, this has caused the varicose veins in the first place. So I now take the ClariVein catheter, which has got a hook on the end of it, and this is going to be whizzing around inside the vein to destroy the vein, and at the same time to stick it together with a sclerosant. The wire has now gone all the way up into the groin. The white bit is an electric motor, and you can see the syringe with the sclerosant in it. We check the position up at the top in the groin, and if we look at the scanner, you'll see a white blob, which is where the catheter is, and then when I press a button it vibrates, and that is the wire spinning around inside the vein, destroying the vein and injecting a sclerosant to seal it all up. It takes 6 seconds per centimetre to destroy the vein, so that's not very long. The patient is lying there peacefully, relaxed, with no pain. When the procedure is completed, we simply remove the wire and apply a bandage. The bandage is split at the knee, so there's one below the knee and one above. The patient is smiling happily, pain-free, and because the bandage is split at the knee can move freely, and he can therefore safely drive and carry on full normal activities. So I hope you found that educational. You could see just how easy it was for the patient to have this done, and they were able to drive off home immediately afterwards. If you would like your veins treating, please contact us at the Liverpool Varicose Veins Clinic, and we will be delighted to see you. Thank you.